Hello, MMOA community. My name is Anushka Ranaraja, and I am a TA with the Modern Management of the Older Adult Division of the Institute of Clinical Excellence. Today, we're going to talk about fatigue in older adults. But first, let's chat a little bit about what's happening in the community. MMOA Essential Foundations starts on October 11th. If you've taken Essential Foundations and are ready to deep dive into specific yet common clinical populations, sign up for Advanced Concepts, which starts on October 12th. MOA Live will be in Bellevue, Washington this week. I'll be out there with Jeff for his first lead course. Super excited for that. Then we'll be in Falls Church, Virginia, October 7th and 8th. Fountain Valley, California, October 14th and 15th. But there are many more courses all over the US to take with us throughout the rest of the year. So take a look to see when we'll be out by you. Now that we've covered that, let's talk about fatigue in our older adult population. Since switching to mobile PT and working solely with older adults, I feel like the number one complaint I get from patients isn't pain, but it's actually fatigue. I think it is something that some providers just write off due to our patient's age, but there's a lot we can do here. According to the National Institute of Aging, fatigue is a feeling of weariness, tiredness, or lack of energy. It can also be a normal response to physical activity, emotional stress, boredom, or lack of sleep. But it can signal something more serious mentally or physically, so that's something that we're going to look at as well. When a patient repeatedly reports fatigue, I like to dive into that a little more with them. Something that we can discuss is lifestyle habits with those patients. Some factors that contribute to fatigue include staying up too late, having too much caffeine, drinking too much alcohol, not drinking enough water, getting too little or too much exercise, we're usually seeing the first one, or boredom. Some tips to improve energy include exercising regularly, trying to avoid long naps late in the day, smoking cessation, participating in enjoyable activities, and eating a well-balanced diet. So you've probably already covered this with patients, but educating them on physical activity can be huge. You can tell them that it can help improve sleep, it reduces depression and stress, and helps boost overall mood. You can also educate them that they may feel more fatigued when they first start a program since it's a new stimulus to their body, but that it will get better and that it is important to fuel for this new stimulus. Something I like to recommend is that the patient or their caregiver journals a week worth of information looking at what and how much they have been eating and drinking, how much exercise they get, what was their overall activity level like, because we acknowledge that physical exercise isn't the only activity that these people might be doing. Do they feel rested the next day? And then looking at what type of social interaction they've had or what activities have they been doing, and really get a feel for how affected they are by all of that. Some of our patients are just emotionally exhausted. This can stem from anxiety, depression, grief from loss of family or friends, stress from financial or personal problems, or loss of mobility and independence. So part of the reason that I really chose this topic is because I had this patient who I took over from another PT. And my first visit with them, we kind of established that she wasn't eating or drinking enough water to sustain like basic basal metabolic rate. She was not interested in eating. So, I educated her on enough fuel and why it's important to fuel and how much protein she should be taking, especially once we started physical therapy. But this didn't really make a huge change for her. I did talk to her caregiver and explain the same things. I encouraged certain snacks for right after physical therapy that were high protein, just to help her get through the day because she definitely did not want to do anything even after physical therapy. So that's kind of where I started at baseline. And I kept encouraging certain little behavior habits. So it's like, okay, when we're working out, after every exercise, we took a little pause break to have her drink some water, and her sips were legitimately sips of water. But it was just like whatever change we can do at the time was important. Then a few sessions later, I had a progress note her. I went in that day and I was like, oh, she's going to do great. We've been exercising. It's been awesome. But she was super orthostatic. Like her blood pressure was 90/48. She couldn't stand for 1 minute. I couldn't even get to actual orthostatic testing because she couldn't sustain standing for longer than that minute. At one point, she like fell back onto the couch. But I wasn't sure what was going on because we haven't been that bad for so long. So while I was in between taking blood pressure and just like working on standing tolerance, I was just talking to her and I said, okay, so what's different today? Like how much dizzier are you on a scale of 0 to 10? What did you do over the weekend? What did you eat and drink? Turns out she spent most of her weekend in bed. She got out of bed for one meal a day, I think both Saturday and Sunday. And not because she was physically fatigued, but she just was not motivated to get out of bed. And that was a huge thing, right? Is if our patients aren't motivated to get out of bed, why is that? So we talked a little bit more about that while in between all of this. And she basically said, if she doesn't have anything to do, then why does she need to get out of bed? It's fair enough, okay? I understand that. But it's how do we encourage our patient to find that motivation to get out of bed? So we talked about, okay, if you don't have family coming to visit and you don't have me coming to do PT, you still need to get out of bed. At the very least, I want breakfast at the table. And I told her and her caregiver this. Breakfast has to be at the table. Your other meals can be in the recliner. We talked about water intake. We talked about electrolytes. But we also talked to her and the caregiver about what kind of activities she might be able to do during the day that will encourage her to get out of bed. Because if that's her number one complaint and number one reasoning to not get out of bed is that she just doesn't have anything to do, then let's give her something to do, something meaningful to her. So it took the whole team getting on board to really make improvement, but we got her family on board. So she was going to more, she goes to her grandkids' soccer games, she goes to shows. At the very least, she goes out with her caregivers to go shopping or to a restaurant, just so that she feels like she has something better to do than sit in bed. But the improvement we've seen since that is amazing. I think her like sit to stand test improved by 30 seconds, which was ridiculous. Her gait speed improved. She just is lifting overall heavier at this point. She's able to tolerate more. And not to say everything's fine and dandy now, because there's still days she doesn't want to get out of bed. She still tells me she'd rather be in bed the days I go, but she also tells me that she likes exercise. So I think we're chipping away at it. But I wouldn't have known the reason that she didn't want to get out of bed was that she didn't have anything to do, and we wouldn't have been able to make that change had I not spent that time asking her those questions. But it's like, if they are fatigued, what can we do to really help them? Okay. On the other side of all of that is fatigue can also be a sign that something bigger is wrong with your body. For example, rheumatoid arthritis. Someone with rheumatoid arthritis often complains of fatigue. People with cancer may feel fatigued from disease or treatments or both. People with many medical problems, including infection, chronic disease, anemia, sleep apnea, a recent stroke, Parkinson's disease, if they're on certain medications, especially antidepressants and anti-anxiety meds, that might be a factor into it. So it's important to take all this information that you have and decide, okay, if we've gone long enough and we've tried all the other things, or maybe it's like we haven't tried, but you're suspecting that, hey, this person needs to go back to the doctor, and then make that referral. Let them know to reach out to their PCP or referring provider. Or maybe you want to reach out to the PCP and referring provider and let them know, hey, like, this is what we've been experiencing. I think it's something that needs to be addressed. So things that you want to really look at. One, if you have a patient who is continuously fatigued, I urge you to dive more into it with them. Don't just write it off as a patient says they're fatigued today, but they're agreeable to physical therapy. I really talk to them. Bill it as self-care, because guess what? At the end of the day, that's what it is. You're really trying to help them create that change. Other things that you want to look at are ask them about diet and hydration, exercise, general activity, what their social interactions are like. Are they depressed or do they feel anxious? Feel comfortable asking them those questions. Educate them on tips to improve fatigue. Maybe you're going to prompt them to do that daily journal and monitor their diet, exercise, mood, and energy, and that gives you a bigger idea of what they have going on. Find out what motivates them and help them get what they need to successfully make it through their day. So next month, I'm going to talk to y'all about motivational interviewing, and I hope to catch you then. But until then, go out and do great things and have a great night.